It is Wellness Wednesday, and for today's segment, Dr. Ken Stewart of KCU Joplin is here to talk about something I think everybody has been plagued with at least some part of their life, and that's headaches.
Yes.
It's one of those things that you get, you don't know what to do about it, you don't know where they come from. I think I'm fortunate in that I don't know that I've ever actually had a migraine, but the people in my life who have them say that they are almost debilitating.
Miserable.
Yeah.
Absolutely. Sure.
So tell us a little bit about what a headache is, how it happens, and what we can do to try to stave them off.
Sure. So headaches are a very common complaint of most people. Over half of the population are going to have a headache sometime this year. And so we want to separate headaches from what's a primary headache from what's a secondary headache.
Okay.
So when we're talking about primary headaches, we're talking about headaches that originate mainly from, up in the head, up in the muscles, vasculature, things like that. Sometimes during different changes of the season we'll actually get pollens that are released, histamines that are released, serotonin that's released, and that's going to contribute to getting a headache. Now you've got other kinds of headaches like cluster headaches.
No, I've never heard that phrase before. So what is how do you define a cluster headache?
So a cluster headache is headaches that come in clusters.
Okay.
Sometimes you'll have several headaches during the day. Sometimes it'll last for weeks, months, and they're usually unilateral on one side of the body or the other. Can cause a lot of tearing, a lot of redness of the eyes.
That sounds awful.
Well, it does. It does. Most of those can be treated with medications that will help prevent those.
Over the counter, or is this something, if you find yourself getting what you think might be a cluster headache, should you go to the doctor at that point or start with an over-the-counter medication?
Yeah, so if you get a mild headache, obviously you can use an over-the-counter medication. If we get somebody that comes in the emergency department and we diagnose it as a cluster headache, we'll sometimes put oxygen on them, and that will help kind of dilate the vessels, and that will help kind of alleviate that kind of a headache.
And how do you do that? Is it an injection that you do?
No,
or?
we just put oxygen on them. Just a mask.
Just an oxygen
mask, yeah. Anti-inflammatory medications, ibuprofen, naproxen, things like that can help alleviate those. If you have chronic reoccurrence of those headaches, like change of seasons, you can be put on a prophylactic medication that will actually help prevent those headaches from occurring. Very similar to migraine headaches. So you've got migraine headaches, you got migraine headaches with auras, and then you've got muscle tension headaches.
So the migraine headaches, we all know, I don't know exactly what the physiology behind a migraine headache is, but I think we've all heard of them. What is the aura part of that?
So the aura part is where they have a premonition that they're going to have a headache. Sometimes they'll have little kinds of things, they'll see flashes, or they'll have little things that will kind of allow them to expect to have a migraine headache. They might see halos around lights, they might start hearing sounds, and that kind of preempts the actual migraine headache. If you're taking a prophylactic medication, you can actually take the medicine at that time, and sometimes you can abort that headache from actually developing a full-blown migraine.
Wow. I do want to back up just a little bit and swing back to something that I have been saying for years, and we talked a little bit in the green room beforehand, and that's that barometric pressure.
Yes.
It is scientifically proven that can affect a headache. It can affect so many other physiological things.
Sure.
Explain how that works.
Yeah, so if you think about it, the skull is filled with hollow cavities called sinuses. And as barometric pressures change, you're going to be getting different pressures. A lot of times people, when they have a difference in the barometric pressure, those pressures inside their sinuses start to change. They start causing inflammation, they start causing some irritation, and that leads to a migraine or a headache.
So I think that's absolutely fascinating. It's one of these things that a lot of people think is an old wives' tale, but it's not, and there's plenty of research to back that up.
Oh yeah, and if you talk to migraine sufferers, they'll tell you the same thing.
At what point, because everybody who's watching this has had a headache in their past, at what point do you need to seek out a doctor's help?
Yeah, so the big red flags are over the age of usually 50 to 60, headaches that are getting worse in quality. If you have a sudden onset of a headache, which we call a thunderclap headache, something very, very intense, or if you have what would be considered the worst headache of your life. Those are the kinds of things that would trigger off red flags. Also, nerve changes, slurred speech, visual changes, all those kinds of things, red flags, get in and see a doctor.
Okay, get in, and because some of the problems could be serious, and you absolutely need to see a doctor to find out how to not only alleviate the headache, to make sure that there's not a problem, an underlying problem.
Sure.
Doctor, it's always so great to have you on. It's so great to have KCU here in the community. We always appreciate when you come on, and we will see you again next month.
Great. Thank you so much, Gary.